To order. First up on our agenda, we are having a hearing on House Bill 2208. And for a bill explanation and overview with the Revisor's Office, Jenna Moyer. Jenna, thank you for the overview.
Thank you, Mr. Chair. Good morning, committee. House Bill 2208 should look fairly familiar to you. It is very similar to what this chamber passed out in Senate Bill 238. I will let you know that House Bill 2208 passed the House with a vote of 124 to 0. And then House Bill 238, which we made a few more additional changes to, passed the Senate 38 to 1. And what House Bill 2208 would do, it started off as the Behavioral Sciences Regulatory Board bill, and then was amended by the House committee to add in these same amendments that the House did, related to telemedicine and relating to the some additional requirements from the BSRB that were stricken. And so the first section of this bill is the telemedicine portion that the Senate put into Senate Bill 238 that would allow certain out-of-state physicians to practice telemedicine with authorization from the State Board of Healing Arts. And then the rest of the changes are related to the Behavioral Sciences Regulatory Board, which is the BSRB that licenses several different practices in the state of Kansas, and all of that will be the exact same as what the Senate passed out. And I won't go through the very long bill unless the committee has specific questions about the Behavioral Sciences Regulatory Board or what is in the bill, because it's all the same as what the Senate passed out. So I'll be happy to answer any questions if there are any.
Jenna, thank you for that explanation. Committee, do we have any questions on the bill explanation? Not seeing any. Jenna, thank you very much. We will now turn our attention to proponent testimony. First up, we have David Vai, the Executive Director of the BSRB. Dave, welcome to the committee.
Thank you, Mr. Chairman. My name is Dave Vai. I'm the Executive Director of the Behavioral Sciences Regulatory Board. And I'm just going to present some brief testimony today. As Jenna mentioned, this was a bill that was requested on behalf of the Behavioral Sciences Regulatory Board. And as she mentioned, we requested identical language in a bill that was heard by your committee, Senate Bill 238. For the items affecting the BSRB, the language in the bill in front of you, amended House Bill 2208, matches the changes that you had made to the BSRB sections of that bill. So I just wanted to clarify that there were two amendments that were made by the committee when you worked Senate Bill 238 to remove new language that would require board-approved clinical supervisors for social workers and to reduce the number of direct client contact practicum hours for social workers seeking a clinical license. The BSRB just wanted to say that we continue to support the original positions recommended by the board. We believe these would ensure greater public protection, but we just wanted to clarify that the items in here reflect the bill as it was worked by you. And the board has not taken a specific position by items not affecting the BSRB that were amended into the bill. But with that, I won't go into the other details since they were already brought up in the other hearing, but I'd be happy to stand for any questions.
Dave, thank you for your testimony. Committee, do we have any questions for Dave? Okay, not seeing any. Dave, thank you.
Thank you, Mr. Chairman.
Next committee, we have Elizabeth Patton, State Director for Americans for Prosperity. Elizabeth, welcome to the committee.
Hi, thank you. Good morning, everyone. Appreciate the opportunity to testify. I think it is fitting in my memories this morning. It popped up that I think it was a year ago today that we left the building, and maybe I'm wrong, but that was the picture on my phone this morning. And just struck me how much has changed in the last year. Just want to say quickly for committee that we very much support the changes that you all made to Senate Bill 238, including the pieces that were just referenced by the previous conferee. We commend those amendments and think they were impactful changes for the future of our state. I wanted to specifically address the telemedicine portion of the bill that we are supportive of. I have several things to say here, but I know that you guys have already heard this bill and I don't want to be redundant, but my big My big point here today is that we have learned a lot over the last year, and one of those things is how to deliver health care a little more effectively, especially when it comes to being flexible and modernizing opportunities for specialists and for folks in our state that might live in underserved areas or rural areas who may have difficulty traveling or maybe choosing or want the option to access some providers, especially who are providing that telemedicine from out of state. I'm thinking specifically of things related to Mayo Clinic, or actually my own best friend who has a son who has a complex heart condition, and because of those reforms has been able to access care from out-of-state providers without traveling and putting her son's health at risk. Some of you may have seen the Kansas City article that came out the other day related to another patient who referenced her hope that these reforms stayed in place. I don't want to invoke her story too much without her permission, but there is a news article I would be happy to send around to committee if you all are interested in that. Reforms such as these have included, privately insured patients have increased their use of telehealth services by 3,552% in Kansas over the last year. So we thought that was a pretty significant number to share with committee. You have my written testimony. Even at the University of Kansas Medical Center increased their telehealth visits from 5 per week in February 2020 to 1,800 per day in April. And we think a lot of that was related to the reforms that not only started with Governor Kelly's executive order, but that the legislature wisely put into the bill during special session and then extended earlier this year. And now here we are with the opportunity to not have our state go backwards, not to re-erect unnecessary barriers, but instead to move forward and help our state continue to provide better access to care. So with that, I would be happy to stand for questions.
Elizabeth, thank you for your testimony. Committee, do we have any questions for the conferee? Seeing none? Oh, sorry. Senator Gossage.
I'm sorry, I was rereading this section. Elizabeth, thank you for being here, and thank you, Mr. Chair. So do I understand this, that they would still, the telemedicine would still be, I think it's line 39 on page 2, a waiver issued under this section shall expire on the date of expiration established by the State Board of Healing Arts unless renewed in the manner established by the State Board of Healing Arts. Could you address that?
Right, so my understanding with that, and we did work with the Board of Healing Arts on this language, pulling it initially from the original legislation I referenced, and my understanding with that was the Board of Healing Arts wanted to have the ability to continue to monitor those out-of-state providers who wanted to practice in Kansas with this specific piece of legislation, and it just gave the board more opportunity to, continue to monitor those providers.
So it's not on a single provider basis, but on total, like they could expire the whole thing?
My understanding was the intention was it was on a provider basis, that
Okay.
when they issued the waiver, that the Board of Healing Arts would then by a provider basis determine if there was an expiration and have the opportunity to do that. That was my understanding of the intent of the language.
Okay, thank you.
Yeah.
Not seeing any further questions for the conferee from the committee? Okay, thank you very much, Elizabeth. Committee, I will like to draw your attention to written-only testimony. We do have 4, Becky Fass, Executive Director of NASW, the Kansas chapter, Kyle Kessler, Executive Director for the Association of CMHCs of Kansas, Jill Lee, an individual, and Kelly Jones, KU School of Social Welfare. Is there anybody else wanting to testify as a proponent? I'm not seeing anybody. We do not have any neutral or opponent testimony. Is there anybody wishing to testify as a neutral or opponent? Okay, not seeing any. We will close the hearing on House Bill 2208, and the chair would recognize Senator Holscher.
Yes, thank you. I didn't quite know the appropriate time to jump in there. I just want to draw your attention to the testimony submitted by Jill Lee, an individual as a proponent. I believe that's probably the individual Elizabeth was referencing during her testimony, and the article was forwarded yesterday or the day before. I've lost track here. But she is an individual in stage 4 cancer who, despite the efforts to try to find somebody in Kansas who could treat her, is in one of those situations where the doctor treating her is out of state. And so I would just encourage you to really take a look at her story and that article. That's the type of situation we're talking about here. Thank you.
Thank you, Senator Holscher, and that was a very heart-touching article, so I hope everybody had an opportunity to read that. Committee, it is my intention to work this bill. First, before we start working it, I've just got to give kudos to our reviser, Jenna Moyer. I've been in touch with her the last couple of days, and things have changed on the direction and changed back and changed again. And she has been very helpful, and I think she has everything ready for us to work House Bill 2208. So Jenna, again, thank you very much for all your hard work and ability to turn on a dime on this. So committee, what I would like to do with House Bill 2208, there's, if you guys remember back to Senate Bill 238 and Senate Bill 138, we combined the contents of 138 into 238 and then kicked that bill out. And we also added the amendments to 238 that made it mirror this House bill that we currently have. And Jenna, just for clarification, I want to make sure we're not missing anything. This House bill is identical to the bill we kicked out on the BSRB portion, correct?
Yes, on the BSRB portion, it is identical. What is missing would be the portions from the, what was it, the other bill that we added?
138?
138, yes.
Okay, very good. So that's the first part that I would like to do, is to get that to where it looks exactly like it 238 did when we kicked that out. And then I've got a couple of other things that we want to add to it. And the whole goal of this process that we're getting ready to do, just so you guys are aware, just so we can get this over to the House, it's in a House bill, so they have the opportunity to concur or send it to conference so we can get this out, because I believe that all these pieces that we're putting into this one bill is very important to our public health and mental health in our state. So I think it's very urgent, and that's why we're going to try to do it this way. So Jenna, are you ready for us to start the sausage making process?
Yes, Mr. Chair, I'm ready. You just have to tell me which amendment we are going to be going with,
Okay.
and I can send it to Danola.
Okay, let's start with adding the contents of Senate Bill 138 into House Bill 2088. And I will wait until everybody has that, and I'll let you explain that again for us if you don't mind.
Okay, so it should be sharing. I just have to send to Danola so everyone can get it. Okay, sorry for that delay. I just prefer to have everything given out to the public. Thank you, Mr. Chair. Jenna Moyer, Office of Revisor Statutes. And what we would do with this amendment would be to add the contents of Senate Bill 138 as a new section to the underlying bill, House Bill 2208. And there you go. This one has it without the comments on it. And it would start here, and then it would be very similar to what passed out in the committee. in Senate Bill 238, with the exception of down here in line 27, this would be C2. The House, when they worked Senate Bill 238 earlier this week, they were concerned about the fiscal note for this bill that was apparently quite high. And so they implemented a staggered date for those CCBHCs to be certified. And this would specify that the Kansas Department for Aging and Disability Services would certify those clinics, 6 within the first year. So that would be 6 by May 1st, 2022. 3 additional facilities by not later than July 1st, 2022, 9 facilities by not later than July 1st, 2023, and D would be 8 additional facilities by not later than July 1, 2024. And then it adds another new subsection 3, or not subsection, paragraph 3, that would allow KDADs to certify clinics in advance of what is specified in this paragraph above, including portions of the specified facilities. And so it's similar, but just with that staggered implementation date that would, the House believed, help to ease the funding burdens for it in the upcoming fiscal year.
Thank you for that explanation. Questions, committee, on this amendment? Senator O'Shea.
Thank you, Mr. Chair. I'm curious how many potential transition CBHCs would there be, right? Without this, you can do this many this year, this many this year. How many total are there in Kansas that could be transitioned?
Jenna, if you don't mind, Kyle Kessler is here.
Yes,
We'll
Kyle
just
would be a
defer that.
great person to answer this, not me.
Kyle, if you just state your name and who you're with, please.
Thank you, Mr. Chairman. Kyle Kessler, Executive Director at the Association of Community Mental Health Centers. So right now where we are, there are 6 applicants or 6 grantees that have been provided CCBHC grants. So this would capture them as soon as they would be eligible and their grant runs out, so that they would transition into CCBHC lookalikes. And then there are another 3 who have applications pending before the federal government. So then that would capture them in the next set. And then we're hoping that there will be other folks, other agencies that would be captured under this eventually.
Thank you, Mr. Chair. But how many total?
How many total would potentially? 26.
Senator Stephan.
Thank you. Where are the 6 at and where are the 3 at?
So the 6 are at one currently 4-county mental health center in southeast Kansas. They cover Chautauqua, Elk, Wilson, Montgomery, and Cowley counties. Horizons Mental Health Center in your neck of the woods, so Reno County and several surrounding counties. Central Kansas Mental Health Center out of Salina and also with several surrounding counties. ComCare in Sedgwick County. And then the others are, oh my gosh, I apologize, I'm blanking. There are 2 others. Southeast Kansas Mental Health Center, which is also Bourbon County, Allen County, and several surrounding counties. And so I think that actually did give me 6. The other 3 that are applying right now are the Guidance Center out of Leavenworth, Atchison, and Jefferson counties. Then High Plains Mental Health Center, which is the 20 counties in northwest Kansas. And then Pawnee Mental Health Center, which is Manhattan and Pottawatomie and Geary County and 7 counties north of there. So this potentially would cover in the neighborhood of 50-some, we would cover half the state in the first round.
Thank you, Kyle.
Thank you, Mr. Chairman.
Any other questions on this amendment? Explanation? Senator Gossage.
This may be a small detail, Mr. Chair, but in the balloon, we say shall, but just below that, it says the Secretary of Aging and Disability Services may adopt rules and regulations as necessary to implement and administer this section. I don't want to put words in Senator O'Shea of what she said, but I'm wondering if, we're saying you must, you shall have 8 additional facilities by not later than, if this could be a may. Just asking.
Jenna, would you mind clarifying that for Senator Gossage, please?
Yes, Mr. Chair, typically when rules and regulations provisions are drafted, they are initially drafted as a may, giving that discretion that rules and regulations may not need to be adopted by the secretary. And as to the shall, establishing this system and shall approve those dates, that is a policy choice. And that would be up to your discretion. So this language of the bill would make it mandatory that those facilities would be approved subject to those applications. And then they would get the option to, the KDADs would have discretionary authority, the may here, down in 3 to do them ahead of those deadlines. And then they would have the discretion to adopt rules and regulations if they were necessary. I hope that answers your question.
Committee, any further questions on this amendment? Okay. Committee, what is your pleasure on this amendment? Senator O'Shea.
I'll move that we pass this amendment.
I have a motion by Senator O'Shea, a second by Senator Gossage to add this amendment to the underlying bill. All those in favor say aye. All those opposed, no. That motion is carried. Okay, committee, next we want to, Jenna, the Senate Bill 175 would be the next one.
All right, so I'm sharing 175. And since this is not any new language, we typically don't send them out unless you would like me to, since it's just available. It's the as amended by the Senate committee version that's available on the legislative website. And this would be the Rural Emergency Hospital Licensure Act.
So committee, this, if you remember, we passed, this is the Kansas Rural Emergency Act, which would allow critical access hospitals and rural hospitals under 50 beds the opportunity to designate themselves as a rural emergency hospital. This is the Rural Emergency Hospital Act that the federal government just passed. This does go into effect, so anything that these hospitals will change designation, that would go into effect on January of 2023, if I remember correctly. And the amendment that we had on the floor was a little telehealth piece, and it passed the Senate.
Mr. Chair, I have it passing 39-0, and I don't have it as an amendment on the Senate floor. I have just the amendment in the Senate committee.
Jenna, thank you. I could be mistaken on that. We didn't do an amendment on this one on the floor.
Thank you, Mr. Chair. Just according to the legislative website, it has the as introduced version and then the as amended by Senate committee version.
Okay, then as amended by the committee would be the one that we want for sure. Then you're correct. Thank you. Committee will give you just a couple of seconds to review Senate Bill 175 as amended by the Senate committee.
Okay. And I can clarify that the change that the Senate committee made was on page 3 in lines 21 through 24 is striking this language that would have required, or that was I believe the concern was requirement of paying for additional services at the rural hospitals if they weren't covered by that insurance company. And that is something that that this committee adopted in those amendments.
Jenna, thank you. And that does refresh my memory on what we did change on that one, so thank you. Committee, do you have any questions on Senate Bill 175 as amended by our committee? Yeah, this is, I apologize, this is on the ks Legislature website. All you would do is just pull up the Senate Bill 175 as amended by the Senate committee.
Oh, and Mr. Chair, if I may, I will note that this was amended by the House Committee this week. And so if you're looking for the different versions, it'll be the second one on that website.
Jenna, do we know what the House did to amend it?
Yes, Mr. Chair. The House amendments added the grant assistance to rural hospitals, which I believe we have discussed already,
Okay, thank you.
or between you and I.
Committee, are there any other questions that we would have for Jenna? Okay, seeing any, what is the pleasure of the committee on inserting Senate Bill 175 as passed by the Senate committee? Senator O'Shea.
Move we insert it.
Okay, we have a motion on the floor by Senator O'Shea, a second by Senator Baumgartner to insert the contents of Senate Bill 175 as amended by the Senate committee into this House Bill 2088. Any discussion on the motion before we take it to a vote? Seeing none, all those in favor say aye. All those opposed, no. That motion is carried. Okay, committee, next, turn your attention, you'll do the same thing. House Bill 2174. Jenna, can you explain that for us, please?
Yes, Mr. Chair. House Bill 2174 is an act concerning hospitals specifically related to rural hospitals that provides grant assistance to hospitals in certain counties. And this is the bill that I was not so subtly referring to, that the House committee had added to had added the contents of this bill to Senate Bill 175. It was originally referred to the Committee on Appropriations. They had a hearing on it. It was re-referred to the Committee on Health and Human Services, and then they had a hearing on it this week, and then its contents were added to that Senate bill. And this would just establish what hospitals are eligible to receive certain grant funding. And there is a pay for that let's see, it would be here on page 3, that on July 1 of this year, that the Director of Accounts and Reports would transfer $10 million from the state general fund to the Rural Hospital Innovation Grant Fund. It would allow the Secretary of KDG to adopt rules and regulations to implement and administer these grant programs. And then ultimately, this bill would have an expiration date that the provisions of this section would expire on June 30th, 2025. And then at that point, if there is any money left in the account, it would just go back to the state general fund. And so the rest of this is just specifying what would go into those grants and how they would be administered and implemented.
Jenna, thank you. And committee, I will try to give you just a quick, brief summary of how the money is generated. It's a matching grant system, so $2 for every $2 that comes in from the private sector donations, the state would have $1. And I believe there's a match with the counties or local, if I'm correct. Jenna, is that correct?
Thank you, Mr. Chair. Yes, this would be in, let's see, it'd be page 1, line 35, that it would be a basis of $2 of private stakeholder monies for every $1 of state monies that would be used to fund the program.
Thank you. Any questions on this? Senator Stefan, did you have a question?
Yes, thank you. And what's this money to be used for?
Jenna?
Okay, thank you, Mr. Chair. I was just making sure that question was for me. It would be for the purpose of the Rural Hospital Innovation Grant Program, and it would be for the purpose of, let's see, it's on line 25 here, strengthening and improving the healthcare system and increasing access to healthcare services in eligible counties to help communities in such counties and maintain optimal health in those counties. And if we look to line 9, I'd say an eligible county would be essentially any other county other than Douglas, Johnson, Sedgwick, Shawnee, or Wyandotte County. So the majority of the state, essentially.
Senator Baumgartner?
Thank you, Mr. Chair. First of all, I couldn't tell, did Senator Petty have her hand up for a question or a statement? I saw her hand up in front of the camera there. I didn't know if anyone else had noticed that. Okay.
Senator Petty, did you have a question?
No, she's just,
Believe she's trying to unmute, Mr. Chair.
Okay, thank you.
and while we wait for her to unmute, I do actually have a question, Mr. Chair. Do we have a fiscal note on this? I understand that there's some matching, but what is the state's obligation?
Jenna, do you have that fiscal note available?
If you give me just a second, Mr. Chair, I can pull it up and I could probably share it if that's what you'd like.
Yes, please.
If I'm unmuted, I'm just going to say that thank you for Senator Baumgartner for noticing, but Senator Steffens asked the question I'm going to ask.
Thank you, Senator Petty.
So, Mr. Chair, this is Jen in the revisor's office, and this would be the fiscal note for House Bill 2174.
Thank you. Senator Baumgartner.
Thank you, Mr. Chair. So it indicates $10 million would be, yes, 10 million would be transferred from SGF. I'm assuming that that was not in the budget component that was voted on last week or earlier this week. Is that still something that would be omnibus? So are we needing to find a pay-go for that?
That would have to end up being an omnibus. Senator Erickson.
Thank you, Mr. Chair. Just a couple of quick questions on that. So the 10 million is a one-time grant that would expire in 2025. Is that correct?
Jenna, correct me if I'm wrong, but that is correct.
Okay, and follow up if I may,
Yes,
Mr. Chair. So this is to be used, to Senator Steffen's point, supposed to be improving the health care of these communities that would apply for this grant. How will we know the effectiveness if this $10 million actually did what it was intended to do? Will we have some metrics or some standards by which we will see before this? Oh, thank you. Before this grant, here's where we were, and due to this grant, it did what it was intended to do, or will it just be we allocate the 10 million and hope it does what it's intended to do? Thank you, Mr. Chair.
Thank you, Senator Erickson. Jenna, do you have that answer to that question by chance?
Thank you, Mr. Chair, Jen in the revisor's office. And I guess I have a partial answer, that prior to entering into an agreement, this would be on page 2, starting in line 33, that when these grant monies would be awarded, that the county would have to enter into an agreement with the secretary that would require those monies to be expended to provide assistance to a hospital. And then not later after, on line 38, not later than 1 year after the grant monies are awarded, they have to report to the secretary detailing the effect that such grant is having on health and other outcomes in the eligible county and the affected community. And if that county were to not fulfill the terms of that grant, then that they would have to repay those monies.
Excellent. Thank you very much.
Senator Baumgartner.
Thank you, Madam Chair. Could you clarify, so is it the Secretary of KDHE that determines the requirements of the grant?
Jenna.
Thank you, Mr. Chair. What I believe is in the bill is the Secretary of Health and Environment. If I said, oh, but then no, it's Secretary of Health and Environment. If I said another secretary, I apologize.
No, you had, Mr. Chair, she had the correct secretary. It's just, is it up to the secretary to determine, I think the language is the terms and conditions of the grant?
Thank you, Mr. Chair. I believe that it would be up to the secretary to determine the terms and conditions of the grant. Yeah, so that would be here on page 3, subsection D, or not subsection D, but it'd be a D here, line 1, any other terms and conditions that the secretary deem necessary.
Senator Stephan.
Thank you. When we worked this bill originally, I don't remember there ever being any discussion about there being a big hole financially in it that needed filling. And then now all of a sudden, we've got some fairly vague terms by which one individual can sign on or off. I'm perplexed as to where there's actually, for all intents and purposes, going to be a reduction in services from these hospitals. I don't understand why we're throwing $10 million at them. And if anybody can help me understand that, I'd be grateful.
Senator, I'll address the first part. House Bill 2174, we've never had a hearing on. That's why this seems different for you. This is a proposed amendment to go into this bill. So we've never had a hearing on it. And this is the first time this committee's actually had an opportunity to see this language.
Okay, that's fair, but we are tying it in to the certification changes of the hospitals. Theoretically, we might be. I think we're throwing money into a situation where we don't really know how the situation is going to shake out. I think it's an irresponsible use of $10 million of taxpayer money, bottom line.
Do we have any further questions about this? Senator Baumgartner.
Thank you, Mr. Chair. I guess I'm just wondering, the folks that are here today, with regard to the underlying bill, the base bill, HB 2208, I'm wondering if any of them can shed any light or if they participated in the hearing of House Bill 2174. In journalism terms, we would refer to this as vague yet hard-hitting. Vague as far as the parameters, the way it seems right now, hard-hitting because, one, it does have a $10 million price tag. Two, hard-hitting because it appears to be an attempt to help our rural hospitals, and improve health in our rural communities. And I don't think any of us are opposed to that. It's the vagueness that seems to be troubling. So if there's someone here that perhaps could shed some light, has this been thought up any more than, I understand this notion of there's matching. If we kick in 10 million, then 20 million will come from the feds. That's the way I understand that, isn't it?
No, 20 million will come from private investment.
Private investment.
Yes.
Understand. Again, I know that people love matching. It still seems very vague. Do we have specifics at all?
Tara Mays is here with the Kansas Hospital Association. She might be able to shed some light on.
Thank you,
Ms.
Mr. Chairman, members of the committee. I am Tara Mays with the Kansas Hospital Association. I'm happy to provide just a little bit of context around 2174 and the discussion that you all are having today, if it is helpful. 2174 is a bill that's been before the House before this 2021 legislative session. And really it is, to get to your point, it is a public-private partnership. And in relation to a previous question about how it really relates to the rural emergency hospital bill, just might add, as we've thought about it and conceptualized it, it is specific in the bill that it's for transitional assistance in ways that you can deliver healthcare in a new and innovative way. And so we think with the rural emergency hospital bill that you all passed and amended, First Senate Bill 175 that you all amended, there would be an opportunity to use the context of a public-private partnership as it's laid out in 2174 for those rural hospitals that might be looking at whether that be financial analysis that would have to be done to transition to a rural hospital, whether it would be something like a analysis of all of the services and modeling of all of the services. So that is kind of where the bill fits in with Senate Bill 175. That's helpful.
Tara, thank you. And would you stand for questions if the committee has some?
Absolutely.
Senator Gossage.
Thank you, Mr. Chair. I'm looking at page 2 of the bill, which describes that the Board of County Commissioners of an eligible county or the board designee may apply to the Secretary for Rural Hospital Innovation Grant. Aren't these hospitals individually, privately owned? They're not owned by the county, right?
So the way that it would work is, yes, the individual hospitals are not necessarily owned by the county. They would go to their county commission to then kind of have an overview process at the local level of those private dollars that would come from other places, maybe a healthcare foundation or something like that.
So it goes on to say a description of the hospital for which the grants monies will be expended. So they have to turn in their name and location, a statement of the amount of grant monies requested, description of the needs of the hospital, the transitional assistance for which the grants monies will be expended, and how such transitional assistance will meet their needs, and any other information the secretary deems necessary to administer this section. So we have some kind of parameters, right? Prior to awarding any grant monies to an eligible county, so the money is going to the county, and then the county is distributing it to the hospital. Is that what I'm reading?
The county then applies to the Kansas Secretary of Health and Environment, and then there's also a reporting component that a year after those grants have been awarded, a report has to be made to the Kansas Department of Health and Environment on how those grants were expended.
And it says the secretary shall enter into a written agreement with the county, expend any such grant monies to provide transitional assistance to a hospital in the eligible county as approved by the secretary. And then, as you said, not later than 1 year. Normally, I believe that any private entity that's asking for grant money, from the state, from a county, whatever, I have concerns about that because I'm thinking at Fort Scott Hospital, how they did all of that themselves. And they got private dollars to help transition that, and it's been very successful. To say that we're going to have other hospitals that are going to receive state funds, whether it's the county that's looking at it or not, concerns me. These are private entities, and I would be a no on this amendment or on this bill.
If I may, Mr. Chairman, just one thing that you mentioned, not all hospitals are private hospitals that would be in this particular situation, the critical access hospitals that are county owned or government owned, and so I just want to make that clarification.
Senator Stefan.
Thank you. I think it's a good time to also point out that this bill opens it up to some very large hospitals. You know, Salina Hospital, Hutch Hospital, Hayes, Great Bend. And right now, you know, the federal government has thrown billions of dollars at hospitals. Hospitals are not underfunded in any way, shape, or form right now. And we are struggling with our budget. And this is not the time for us to commit $10 million to an unknown project filling a hole that was never advertised to us in the first place. So I'm a no as well.
Senator Baumgartner, then Senator O'Shea.
Thank you, Mr. Chair. This is an observation. This really isn't a hearing on this bill. So I feel in some ways we're kind of guessing at some of this. I'm not ready to say an absolute no, but I think it would benefit us if we were to have some type of a hearing on this. There is an option that it could be a proviso. I think that we need to know more about this. There are a few things I think I might even want to amend. I am a little concerned about a private stakeholder can indicate, I want my money just to go to this county. And I think that puts some counties in our state at a disadvantage if they don't have someone that can pony up the kind of money that they might need. I would like to have us keep the door open to potentially work this between now and veto session. Mr. Chair.
Thank you, Senator Baumgartner. Senator O'Shea.
Thank you, Mr. Chair. I was just curious the context and history of, it appears to me that it was in the House Health Committee but didn't make it out, but they had a hearing. And so I was just curious what that history was.
Jenna, do you know anything on that? And Senator Petty, I see that
Yes,
your
Mr.
hand
Chair.
is raised thanks to Senator Holscher, so we'll get to you in just a second. Jenna,
Okay,
go ahead.
so this bill did have a hearing in the House Committee on Health and Human Services, and its contents on, this would have been Tuesday, were inserted into Senate Bill 175 and passed out of committee.
Thank you, Jenna. Senator Petty.
Thank you, Mr. Chairman. I actually am not opposed to having further looking at this further, and this is in, if I'm understanding this correctly, it is in the House bill. So if this went to conference, it would be conferenceable because it's on one side. But I just want a reminder, when we have put Senate Bill 175 into the House Bill 2208 already today, and that deals with the Rural Hospital License Act. And this particular Bill 2174, these grants are specific to communities that are working to transition to being a rural emergency hospital. Is that correct, Jenna?
Thank you, Mr. Chair. I don't believe that there's any language in this bill that would specify that those hospitals have to be transferring to that specific rural hospital certification.
Okay, so that is a little bit concerning to me, because I think the Rural Hospital License Act is an important item, and I can understand and that does involve community involvement, community participation, and I think that is also a consideration when we're looking at inserting HB 2174 into this. Thank
Senator
you, Mr.
Petty.
Chairman.
Thank you. Do we have any further questions on this? Committee, just by voice, it doesn't appear we have support on this moving forward, but we do have support on maybe having a hearing on it. We do not have a bill on this here, so it would have to be more of an informational hearing type thing. So that might be something that we can fit in maybe on the Monday or Tuesday that we've got an extra day given to us. If that's something the Kansas Hospital Association is interested in doing or not, we'll work and look and see at that. Unless the committee has a different opinion or gauge the room differently than I do, what is the committee's preference on House Bill 2174 inserted? Senator Gossage.
I just wanted to clarify, when I said I'm a no, I was a no for insertion. And fine to have a hearing, but for inserting that today, I would be at a no.
Senator Baumgartner.
Thank you, Mr. Chair. I would agree, and when I look at the fiscal note, it is a little troubling, and I'm just going to point this out because it says it's referring to transitional assistance, and that would be defined to mean any assistance related to changing a hospital's current healthcare delivery model to a model that is more appropriate for the community served by the hospital. And I have to say, having a background in not only healthcare but in business, it's imperative that you are constantly working toward what is your model, how are you serving the community or the industry that you have put yourself in. So I think this would need a whole lot more work because hospitals should be on an ongoing basis addressing how it is that they meet the needs through delivery of the community that they serve. That should be what they are doing on an ongoing basis as technology changes and as the needs of the community change. Thank you, Mr. Chair.
Okay, committee, do we have any further questions or what's the will of the committee? Senator O'Shea.
I do like the idea of an informational hearing.
Okay, committee, we will not insert the contents of House Bill 2174. Committee, do we have any, what's your desire on the underlying bill of House Bill 2208? Senator Holscher.
Thank you, Mr. Chair. I move we pass out the underlying Bill 2208 favorably for passage.
Okay, we have we probably should make this a substitute.
Substitute bill, now 2208.
Okay. We have a motion on the floor by Senator Holscher to pass out, make this a substitute, House Bill 2208 as a favorable for passage, and second by Senator Erickson. Any questions on this motion before we take it to a vote?
I would like to refer, thank you, Mr. Chair, back to something that Senator Petty said about being clear that 2174 is not inserted by via of another vehicle that we put into 2208 already.
That is correct. The contents of House Bill 2174 are not in this bill.
Okay, thank you.
Senator Baumgartner.
Thank you, Mr. Chair. That, as clarification, is because the Senate Bill 175 that we inserted was our language.
That is correct. We use the Senate amended version. Senator O'Shea.
Thank you. I have a question. Thank you, Mr. Chair. If we waited to do our informational hearing and then we decided to put HB 2174 in, would we want to kick the bill out then? Like, is there a reason to kick out the substitute bill today before we do that informational hearing for this last piece?
What we would do on an informational is there are other things that we have that we would probably attach inside of a conference committee report. Seeing no further questions on this motion, all those in favor say aye. All those opposed, no? Would you like to have your no vote recorded? Okay. This motion is carried. Senate substitute for House Bill 2208 is going to the floor. Thank you.
Are we adjourned?
We are adjourned. Thank you. Sorry.